We turn our attention now to a looming health crisis. Severe cholera that remains untreated can kill up to half of the people that it infects. Sharon Momanyi has been following this latest outbreak of the disease, and she joins us now from our city centre studio. Good evening, Sharon. What have you discovered about this latest outbreak?
Yes, Nancy, the situation seems to be fast becoming a crisis. Now it's getting to 2 months now since the onset of the cholera outbreak, and so far in the Mbagathi District Hospital here in Nairobi, 7 fatalities have been recorded, and also 101 patients have been admitted at the facility due to the suffering from the cholera. And this is just showing that the situation is becoming very bad. And in Nakuru County, 12 people have died from the disease, 2 from Migori, 2 from Mombasa, and officials are attributing this outbreak from the rainfall that is being experienced across the country, particularly in areas which suffer poor drainage. And this, as you will see in the report that I put together earlier, happens to be areas that are densely populated here in Nairobi. The most affected areas, the most affected area particularly is Kibera. Most of the patients who have been admitted at the Mbagathi District Hospital come from the area, and some of them also come from Kayole and the Mukuru and Jenga slums. And some officials are also saying that more needs to be done in terms of preventive measures to stop this looming crisis. And here now is that report that I put together. In an isolated ward at the Mbagathi District Hospital lies 44 cholera patients. The number of patients is up from the 35 that had been admitted Wednesday. 7 people have since died.
Majority of the patients initially were from Kibera, but now we are beginning to see patients from all over Nairobi. We have had cases from Mukuru, we have had cases from Kayole, we have had cases from Kangemi, we have had cases from Isili, and now we also have 1 case of somebody who traveled all the way from Siaya.
Andrew Sule, the medical superintendent at the hospital, says that the facility has taken extra measures to handle the big number of patients.
In terms of logistics, we have gotten a lot of support. We have got enough beds and linen. We received recently from KEMSA. We have enough detergents. We are having a lot of support from MSF Belgium. The county has posted extra nurses and clinical officers, and MSF Belgium has also added a total of 4 staff.
The number of fatalities in Nakuru County has risen to 12, with officials reporting that infections have also risen from 76 to 85. Officials say the spread is due to unclean water through sewer lines coming into contact with broken clean water pipes as a result of vandalization. Ronda Estate in Nakuru has reported the highest number of victims, followed by Bondeni and other areas.
I would advise the public really, eat the food you are sure of how it is prepared. And the best food one should eat is the one you have prepared yourself. Be very careful about the water. Even the water from the tap, I think it is better boiled before they drink.
Many people have died since the onset of the outbreak in March. Other than the 7 fatalities in Nairobi and 12 in Nakuru, 10 died from the outbreak in Migori, 2 in Embu and 2 in Bomet. Mombasa has also been affected.
Though we've had 44 cases coming to our center, but only 11 who have actually confirmed positive cases.
Officials attribute the outbreak of the disease, which is caused by contaminated water, to the rains being experienced across the country, particularly in areas with poor drainage and sanitation. In a bid to contain the situation, Nairobi County officers raided poultry kiosks said to be slaughtering chickens without licenses along Jogoo Road. The officials advised all the poultry vendors to use only the licensed slaughterhouses, which include Bama, Maziwa, and Karioko.
Anyone buying any poultry or meaty stuff must look for a stamp. from the county government.
Over the last 1 month, 101 cholera patients have been admitted at this ward in Mbagathi District Hospital, showing that the outbreak is growing to be a crisis. Sharma Manyi, KTN, at the Mbagathi District Hospital in Nairobi.